Both my parents were born in Italy, and they immigrated to Canada in the 1960s, and that's where I was born, in Toronto, Canada. And then I moved here to Orange County with my family when I was about 9 or 10 years old. On February 4th, 2019, I went out to lunch with my friend Julie, and I thought I had food poisoning. My symptoms never went away. It was weeks, and eventually my skin started to turn yellow. And so I called my doctor, and he's like, get to the ER right away. So I went to Hoag Hospital, the ER there, and from there they ran a bunch of tests, including an ultrasound, and that's where they found the cancer. After the test, one doctor was holding my hand. My parents were at the foot of my bed, and I thought something was up when he was holding my hand, and I looked up to him, and he's like, I'm so sorry, I have some bad news for you. And I was like, what? And he's like, you have cancer. I go, what kind of cancer? And he said, pancreatic cancer, and my world just stopped.
The cure rates for pancreatic cancer are not as high as other cancers that we are familiar with, such as breast cancer or prostate cancer. And so seeing someone like Laurie was a challenge.
Everything flashed before my eyes. I see my parents, and I was like, I can't have my parents bury me. I met Dr. Siri at Hoag Hospital after my Whipple surgery, and she was God sent. I call her my 5-star general. She's like in charge of everything with me. I put my trust in her 100%.
I met Laurie literally 4 days after I joined the staff at Hoag. When Laurie was first diagnosed, she was considered resectable. That means she was able to have surgery to remove the cancer. So she initially underwent the resection, which was a Whipple operation. And then after that, we typically give 6 months of chemotherapy. So we did all that. We had our celebration party with her immediate 25 family members that came to the clinic. And then we started what's called surveillance. And during surveillance is when we look to see if the cancer has come back. And she did have a relapse.
1 year after I was cancer-free, my cancer came back. This time in the liver and in the stomach. I've been studying boxing for over 20 years. Physically, I've been punched in the nose, kicked in the throat, punched in the stomach, but nothing has hit me harder than the word cancer. But I have to get up and push through it. And thank God for Dr. Siri. She was calm. And she's like, I have a game plan already. I was like, you do? She's like, we just got a new machine at Hoag.
When we did find the recurrence, it was right when the view ray was open and ready to receive patients. So not only was I excited, radiation oncology was super excited. And she was one of their first patients to have the radiation to a metastasis in her liver. And she tolerated that treatment super well. She actually gave some suggestions for future patients on how to handle it, and she's been doing great.
The MRI Linac came to Hoag as a gift from the Kuntz family. It was one of the newest technologies available. Not many centers had it around the world, and we were one of the first centers to install it. With that, we have been able to treat areas of disease that we never thought imaginable. So it's really opened up a new frontier in terms of radiation options. We've improved survival rates while at the same time reducing side effects. And philanthropy has really touched every aspect of patient care in our field.
The third time I got diagnosed with cancer, I was better mentally prepared this time, but I'm here thriving, and I'm able to travel, and live my life. I love the nurses. They really take care of you. They don't want you to feel not even a little bit of pain, which is great. And that's what I loved about Hoag, because I truly felt cared for.
We always want to do the best for all our patients, but certainly for someone like this, you also turn into a cheerleader, so to say.
I was cancer-free in June. 2 weeks later, I was in Italy, and I had the best time there. I celebrated my birthday there, and I saw my friends and family. The type of care that I received at Hoag, you have to experience it, to really understand what they do and how they take care of the patients. And I'm so grateful for them for being on the ground, finding the new treatments and care for the best possible care for cancer patients. And I'm proof of that. My name is Laurie Paolone, and this is my story.